Colleagues from Hamdard Foundation Pakistan, honorable guests, young fellows, I am honored to read this message on behalf of the WHO Regional Director for the Eastern Mediterranean region, Dr. Hanan Balkhy. It is with immense pleasure that I address you all at the International Children's Health Conference on the occasion of World Health Day 2025. This year, the theme of World Health Day is Healthy Beginnings, Hopeful Futures. The World Health Organization is launching a year-long initiative dedicated to maternal and newborn health, also entitled Healthy Beginnings, Hopeful Futures. This campaign calls on governments and the health sector to intensify efforts to end preventable maternal and newborn deaths while prioritizing the long-term health and well-being of women. Recent estimates indicate that nearly 300,000 women lose their lives annually due to complications during pregnancy and childbirth. Additionally, over 2 million babies die within their first month of life, and approximately 2 million more are stillborn. That is roughly one preventable death every 7 seconds. Alarmingly, 80% of countries are not on track to meet the 2030 targets for improving maternal survival. And 1/3 of countries are projected to miss the targets for reducing newborn mortality. In the Eastern Mediterranean region alone, nearly 400,000 stillbirths occur each year, and approximately 500,000 newborns lose their lives, accounting for almost 60% of deaths among children under 5 in the region. To ensure the survival and well-being of every woman and baby, it is essential that women and families are protected by laws and policies that safeguard their health and uphold their rights. Globally, women and families need access to high-quality care that provides physical and emotional support before, during, and after childbirth. Health systems must evolve to address the challenges impacting maternal and newborn health. Your role is crucial in achieving the goals of this campaign. Dear leaders of the future, you can make a significant impact by raising awareness about maternal and newborn survival among your peers and families, sharing information on social media, and participating in events, conferences, and community discussions. Your contributions to the global effort are vital. This includes participating in fundraising activities, charity campaigns, and creative initiatives. You can be ambassadors of change by advocating for and urging governments and political leaders to prioritize the long-term well-being of women. We must all collaborate to advocate for effective investments that improve the health of women and babies, support the parents and health professionals who provide essential care, and share valuable health information related to pregnancy, childbirth, and the postnatal period. Together, we can achieve a healthier future. Thank you.